Good morning, future radiographers, and welcome to today's Explainer. Imagine we're sitting right together in a bustling, vibrant university classroom because, well, we've got an absolutely incredible journey ahead of us today. We're going to be traveling all the way from the womb right through to old age. So go ahead and fasten your seatbelts because when it comes to human development, there are absolutely no shortcuts.
Okay, let's dive right into this. Here's our roadmap for today. We're covering the prenatal and neonatal stages, the active years, growing up, maturity, and aging, and we'll wrap it all up with a summary and some real-world clinical applications to tie everything directly into your future practice.
So, let's kick things off with Section 1, Prenatal and Neonatal Stages.
You know, long before a baby ever says mama, or even takes that very first breath, there is some intensely complex development happening for months. During the prenatal stage, we're talking massive fetal growth. We see the very first development of reflexes and actual responses to sound and touch. Now, crucially for us in healthcare, maternal health and genetics are the absolute foundation here. We literally have to consider how things like maternal drug use or inherited diseases can dramatically alter fetal development. And yes, that absolutely includes the early stages of skeletal formation, which you'll be imaging day in and day out as radiographers.
All right, let's test that knowledge right away. Which of these conditions may affect prenatal development? Is it A, hypertension, B, Down syndrome, C, malaria, or D, asthma? Now, I know malaria is a massive environmental health concern in many of our communities, but if you guessed B, Down syndrome, you hit the nail right on the head. Genetic conditions like Down syndrome are prime examples of factors that can profoundly alter that crucial prenatal stage.
Moving right along, we transition to the neonatal stage. This covers birth to about 4 weeks, and wow, is it a highly vulnerable time. The major hurdles here are feeding, bonding, and getting that independent breathing and temperature regulation going. This is also exactly when healthcare workers rely heavily on the APGAR score. That's a rapid clinical assessment of 5 things: heart rate, breathing, muscle tone, reflexes, and skin color, just to immediately gauge a newborn's health. And of course, we always have to be prepared for the delicate complications that can pop up with premature babies.
Time for another quick quiz. How many hours do you think newborns sleep every single day? Is it A, 4 to 6 hours, B, 8 to 10 hours, C, 14 to 17 hours, or D, 20 hours? The correct answer is C, 14 to 17 hours. Honestly, at this stage, babies are sleeping even more than university students do during final exam week.
Moving right into Section 2, the active years.
If the neonatal stage was all about basic survival and, well, a ton of sleep, this next period is where cognitive and language development absolutely explode. I mean, in just a few short years, we see a massive jump. Between birth and 18 months, during infancy, it's all about foundational cognitive development, the very beginnings of language, and forming vital social attachments, smiling at their mothers, fathers, and aunties. But fast forward to early childhood, ages 1 to 5, and suddenly they're learning their ABCs, mastering toilet training, and entering what I like to call the most dangerous phase of all, the endless why phase.
Now, what's really fascinating, and honestly a bit terrifying for parents, is the reality of that infancy exploration phase. This is the stage where babies put literally everything in their mouths, including your phone charger. It's funny, sure, but it highlights a super crucial developmental milestone: extreme physical exploration. They are testing their toys and testing the world using their senses. As future radiographers, you absolutely need to keep this in mind when you're trying to keep a squirming, endlessly curious infant safe and perfectly still for an X-ray.
Let's keep that interactivity high with a quick check. Which milestone occurs during early childhood? A, retirement planning, B, toilet training, C, marriage, or D, menopause? Well, I think we can safely rule out retirement for a 4-year-old, right? The correct answer is B, toilet training. It is a major, major step in physical control and independence.
All right, Section 3, growing up.
We are now entering middle childhood, roughly ages 6 to 12. And this is the stage where report cards suddenly become full-blown family meetings. Life isn't just about playing in the dirt anymore. It's about reading, teamwork, and facing the high expectations of the extended family. Aunts, uncles, grandparents, everyone is weighing in on your academic success. The academic and social pressures really ramp up here, and building self-esteem becomes a massive part of a child's day-to-day life, both at school and at home.
And then we hit the turbulent tween and teenage years, adolescence. It is a total whirlwind of change. Puberty brings rapid physical changes, including the closing of growth plates.
Let me tell you, that is absolutely vital knowledge for any radiographer assessing skeletal maturity. But psychologically, it's all about identity formation. They're experiencing deep emotional shifts, navigating intense peer pressure, and starting to explore careers. Social media, peer interactions, and just figuring out exactly who they are completely dominate their world right now.
So with all that in mind, let's do a quick check-in. What is a major challenge during adolescence? A. Peer pressure. B. Crawling. C. Reflex development. Or D. Retirement. The answer is pretty clear here. It's A. Peer pressure. Understanding these social dynamics is a real game changer. It's key to effectively communicating with teenage patients who might be feeling super vulnerable or highly self-conscious when they step into your clinic.
Which brings us to Section 4, Maturity and Aging. We've officially survived the teenage years, and we're stepping into adulthood and older adulthood. As they say, this is the stage where the bills finally arrive, and suddenly your parents seem very, very wise. Early and middle adulthood is essentially the building phase. It's heavily focused on career development, navigating relationships, and parenting. But as we transition into older adulthood, the focus shifts drastically. It becomes much more about reflecting on one's life, adjusting to retirement, and dealing with the realities of health decline. We're talking conditions like dementia and decreasing bone density, which, for us, means a lot more fracture patients coming your way.
I actually want to draw your attention to a very specific psychological concept for middle adulthood: generativity. This is Erikson's concept describing the desire to guide the next generation. In many of our communities, this looks like our elders stepping up to mentor the youth. They want to leave a lasting legacy rather than experiencing stagnation. Middle adulthood is fundamentally about contributing to the future, whether that's through community leadership, family, or work.
And as we reach older adulthood, it's so important to remember the humanity and the joy in this stage, even amidst the health declines we just talked about. I mean, grandparents may forget names, but they never forget where the snacks are hidden. It's a lighthearted reminder that older patients bring immense warmth, rich family history, and deep life experience into the clinic with them. They absolutely deserve care that respects that incredible legacy. Finally, Section 5, Summary and Clinical Application. Let's run through a rapid-fire review of the key concepts we've explored today. See if you can answer these out loud before I do. Number 1. Which stage involves identity formation? Yep, that's adolescence. Number 2. What score assesses newborns? The APGAR score, exactly. Number 3. When does puberty begin? Adolescence again. And number 4. Where do we see Erikson's concept of generativity? That is squarely in adulthood.
When we take a step back and put this entire chronological journey together, from 0 months in the prenatal stage to a 4-week neonate, 1.5 years in infancy, 12 years wrapping up childhood, 18 years finishing adolescence, all the way to 65+ years moving into older adulthood, it brilliantly illustrates a core truth. Human development isn't just something that happens to kids. It is a continuous, lifelong process of physical, cognitive, and social change.
Which brings us to our final and most important takeaway. Every single patient you see has unique developmental needs. Understanding these stages doesn't just help you pass a biology exam, it fundamentally makes you a better, more empathetic radiography professional. You're going to know exactly how to comfort a squirming infant, how to communicate with a peer-pressured teen, and how to safely image an elderly patient with fragile bones. But development has one final unavoidable chapter. Are you ready for the final stage? Because in our next explainer, we are going to explore the Kubler-Ross stages of grief and the profound realities of death and dying. Thank you so much for learning with me today, and I'll catch you in the next one.